the general public. Some of you may want to know what an individual mandate is. One of the issues about our healthcare system today is that not everybody has access to health insurance, and then some people choose not to get insured. Sometimes the people who are choosing not to get insured, they tend to be younger, healthier folks. And you might say, well, why would they need to get insurance? Why would that be important? And it has an effect on our overall healthcare system, because if they get catastrophically ill, then they don't have a way to pay for those things. And the other thing that happens is that they tend not to get the preventive care that they should be getting. And then finally, in order to have essentially to have your costs wind up coming down for an overall health insurance company, what the health insurance company wants to do is have the healthiest, youngest population that they can. Obviously, because they're not using it, they're not using the health services as frequently, and so you're able to cut down. The health insurance company is able to cut down on their costs and not, have as much going out the door, and hopefully they'll be taking in more, and with the way that you make a profit, right? So an individual mandate would make sure that it has a dual function. One, it makes sure that everybody everybody is covered, so that even though you're a young, healthy adult, and in your everyday life you may not need it, when you do get catastrophically ill, you have something there that will help cover those costs. So it helps at that end of it. And the other thing that it does is if everybody has health insurance, and everybody's required to have health insurance, and you have something on the health insurance side that makes it so they cannot turn anybody away, it winds up evening everything out, that's what an individual mandate is designed to do. I don't know how much more details I need to go in here. Do folks know what a benefit package is? It's what's going to cover, right? Okay. Cost sharing. There's different kinds of cost sharing that you can have with your insurance company. You can have something called a copay, and that's when you go into the doctor, you're asked to give so much up front, usually. It can range anywhere from $5 to $50 or more. And it's for every visit. Each time you go and use the healthcare service, there's a copay. There's also deductibles. I don't know if you ever had a hospital stay, but frequently you'll have deductibles with a hospital stay, and that's when you go in there and your insurance will cover 80%, you come up with another 20%. There's also things called lifetime maximums, which means that as long as you're with that healthcare company, you don't go over, for example, $1 million, which is usually okay, except for those cases in which there's some kind of catastrophic issue where someone can go over that. And if that happens, then those individuals are essentially paying all of their costs out of pocket. Those are some of the basics of some of the terminology that's being used at present, some of the discussions on the terminology side. And with that, I'll just turn it over to who the next person is.
Oh, you want to go to me?
Okay.
Hi, I'm Steve Ross, and I was asked to speak on the panel to bring the theological perspective. I'm a United Methodist Christian, and so my theological perspective comes from that background. So I'm not here to speak about how healthcare is delivered in terms of the services that are offered, nor about how we pay for it, but about what is it that Christianity, as I have studied it for 35 years, says about what would be an acceptable healthcare system to Christianity. And so I have just two pretty simple things I think that I want to say about that. And I'm not going to quote a whole lot of scripture because these are drawn from pretty generic base of biblical understanding. The first one is that the biblical mandate would be that no healthcare system is acceptable to Christianity that rations care based on people's ability to pay for it. The biblical mandate is very clear, usually using the terms widows and orphans as people who do not have their own resources in biblical culture, that they were not to be denied housing, shelter, food, the basic necessities of life. So Christians would say about a healthcare system that it is failing to meet adequate standards if people who can't afford healthcare can't get any. So that's one measure that Christianity would bring to a healthcare system. It doesn't say necessarily how you would make sure that people do have that access, but it does say if it's not providing access to people simply because they're poor, it is not an acceptable healthcare system. The second thing I would like to say about healthcare delivery system and Christianity, and this is perhaps an argument or a statement that you should understand would be more encouraging to conservatives. It is that whatever healthcare delivery system we have as a people, it cannot be looked at in disconnection from other things that communities of people need. So to put that in really literal terms, I would say if healthcare costs half of what everybody is doing, it's not acceptable. People also need parks and schools and fire departments and police departments and vacations and food and all these other things. So that if we say, well, the only thing that matters is access, so everybody should have all the health care they want whenever they want it, and gosh, it costs 75% of what we do together. That's just the way it is. That is not acceptable from a biblical perspective. People are not just bodies, and life is not just taking care of some single physical aspect. So Christianity would also say if we are bankrupting other important aspects of our life as a community, schools, parks, those kinds of things, that is not an acceptable way to do health care. So those are the two principles that I think the Christian tradition has to bring to bear to this whole debate.
I mean, several attempts at kind of thinking about putting down some sort of opening statement, and I no dearth of opinions. I've got lots of opinions on this topic, but I found that my opinions kind of vary whether I was coming at it as a Christian, as an American, as a business owner, as a physician, as a primary care physician, and I thought, you know, if I try to hit all these points, I'm going to talk forever. So I'm hoping that maybe some of my opinions, from whatever angle I'm coming at, will maybe come out in the question and answer period. I think it's pretty safe to say that I, like most people, think we are in a bit of a crisis. We've been in some for some time, but I do think it's at a point now where it's really becoming more and more two-tiered and critical. But I honestly, again, looking from all those different perspectives, think this is an incredibly difficult debate. Lots of answers, things I like, things I don't like. So I'm hoping to learn some things here today too, because I don't have any obvious answers, but I'm more than happy to give my opinions.
Well, I can say I too don't really have an agenda specifically to speak on in terms of nursing. I am currently employed with the local hospice here. And so there are certain things that come to me as a registered nurse and someone who provides services to the sick and the dying that I feel that are important to to clarify. One of them is this death panel issue. As a hospice nurse, I run into a situation where I have a patient who has no durable power of attorney. The patient's relatives live in Florida,